So we've got Caleb from Apollo Beach. How long is the new teeth now surgery and what is the recovery period? How soon can I eat after surgery and will I need pain medication? We kind of touched on it, but do you want to answer it again?
Yeah, Caleb, look, just one question, man. Keep it simple. So it's like 4 questions.
I know.
All right, so the procedure, if I can remember all the questions, typically is about 3 to 3.5 hours. And it depends on if you have teeth, if you don't have teeth, you know, just because it does take a little longer to take out teeth. And if, you know, if there's a lot of impacted teeth, sometimes it's a little bit more difficult to get those out or just take some more time. But it's typically somewhere 3 to 3.5 hours to do the surgery. Then you're plan on being at my office with me for the entire day.
Right.
Because whatever time it takes for me to do the surgery, it takes about that same amount of time for the lab to make your teeth custom fit your implants. And that, I mean, that has to happen because it's got to be perfect. We want it perfect.
Perfectionist.
The recovery, which I think was question number 2, is I always tell patients to expect somewhere between 3 and 7 days. So you may or may not have some bruising. You may or may not have some swelling. You know, I stopped a long time ago trying to figure out, like, and tell patients, yes, you're going to get it. No, you're not. Because pretty much every time I was wrong. You know, you'd think that a patient on, you know, and we treat patients who have all kind of medical conditions, people on blood thinners, you know, and it's not a problem. But I would think that someone on blood thinners would bruise and swell more. Sometimes they do, sometimes they don't. You know, sometimes the harder procedures you would think would have more swelling and bruising, sometimes they don't. You know, so it's hard to say. So somewhere between 3 and 7 days would be the typical recovery. And, you know, can you eat after surgery? Absolutely. We want you to eat because, you know, the better nutrition you have, the better you're going to heal, the quicker everything's going to heal. So you can go home, you know, we can, you know, basically put your teeth in at the end of the day of, and you can go eat supper that night, dinner that night on your new teeth. Sorry, the Kentucky supper was coming out. Did you hear that? And the pain medicine after, we kind of talked about that. I do give you pain medicine just in case you need it. But most people do fine with just Advil or Tylenol.
Let's watch Paul because he couldn't believe how quick and easy the recovery was either. And he's one of those quick healers. I think he played golf the next
and Paul,
couple days.
You know, he comes, as you know, he does come to some of the our kind of outside seminars. So we're giving a presentation. He'll just show up and be in the crowd, which I love because, you know, we don't call and ask him, can you come? But he wants to come and he wants to answer questions, you know, live for patients, show him his teeth and talk to him about the recovery, just because he can't believe it.
Yeah, he was in disbelief. Let's watch.
Well, before New Teeth Now, my teeth were just a mess. My teeth were all not lined up in the right positions, okay? And so like my canine was hitting the wrong tooth, okay? And then so I was wearing holes in my teeth and just kind of shearing them off. When I went to New Teeth Now for the very first time, I met with Dr. Kirkpatrick and Shauna, who's the coordinator, and they sat down and spoke with me for, I bet you, an hour to an hour and a half, probably, a full consult, and they made sure that I was comfortable with the whole procedure, and off we went. When the procedure was all done, and they flashed a mirror at me to look at it, I says, wow. I said, how can that be my teeth in one day? You know, I walked in with my all crooked and yellow and busted up teeth and walked out the door with a full set of perfect teeth. It was pretty amazing. Okay, to see how that can all happen in one day's time, you know. I had heard people saying that there's no pain, okay? And truly there was no pain whatsoever. I had a full bottle of the prescription drugs that they sent me home with. And I never took a single one. I just took a couple ibuprofen just in case and woke up next morning and I was perfectly fine. Basically on Monday or Tuesday of that next week, I was on the golf course again playing golf. I wish I would have had done when I was 20, okay? You know, walk in, done. You know, and your teeth are corrected for the rest of your life and they look perfect, you know. So I would not hesitate a moment telling anybody to have this procedure done. Again, I can't say enough about New Teeth Now. Just go in, have it done, and be happy the rest of your life, and smile a lot.
It's all right.
So I love what he said, and that's common for patients. Once they're totally finished and they have their final teeth in, you know, he said, just go in and do it, you know, and then smile a lot. Put the teeth behind you. You don't have to think about it anymore. But he also said he wished he had done it, you know, years early, in his 20s, you know, and that is a really common thing that we hear people talk about, like when we're asking them, you know, because we want to know what they experienced, if they're comfortable, you know, how the experience was, if we could change anything to make it better. And, you know, most patients, they'll say, no, I mean, you all did great. I'm just mad I didn't do this 5 or 10 years ago. Because, you know, I spent more money trying to do this and, you know, save these teeth. And ultimately I ended up having the procedure. I should have just done this 5 years ago. And that's a really common comment that we hear from our patients after. It's just, they should have done it sooner.
If you would like to view more informational videos on New Teeth Now, please click the subscribe button here. Thanks for watching.